I share Singaporeans' disappointments on these new restrictions. We had all hoped that we could put these restrictions behind us, especially with our high vaccination rates and with our plans to move forward to a COVID-resilient nation. But the reality is that with the current infection trajectory, our healthcare system and our healthcare workers are facing many pressures. And that's why we had to make this very difficult decision to apply some brakes and to slow down the rate of transmission. I would like to join my co-chairs in assuring everyone that we are still committed to our reopening plans, and we are continuing to stay the course in our journey towards being a COVID-resilient nation. That's why you would have noticed we are much more targeted in our tightening measures this time. We are focused on reducing the group size so as to scale back social interactions. We have left many other parameters untouched. For example, we are still allowing mask-on vaccinated events to continue. These are generally of lower risk and they have not resulted in large transmission clusters. We are still continuing with our plans for travel. For example, we started the vaccinated travel lane pilots with Germany and Brunei, and the pilots have demonstrated that it's possible for vaccinated persons to travel safely. And we are still proceeding with our plans to allow our dormitory workers to come out and be in the community. So where it makes sense, we have allowed these measures to continue, and we will continue with these measures. But we are taking a careful, calibrated approach to tighten certain restrictions, and these will reinforce our own individual efforts to scale back our social interactions. By doing so, we will be able to stabilize our new healthcare protocols, especially for home recovery. We will give more breathing space for all our healthcare workers who have been working flat out throughout these past 20 months. And we will be able to augment our healthcare capacity further. This period will also allow more people to have their first jabs and seniors to get their boosters. So I seek everyone's cooperation and support for these measures. Even with these measures, as my co-chairs have said just now, we do not expect numbers to come down at all. In fact, they will continue to rise, but hopefully at a slower rate than before, so that we can ride through this wave without overwhelming our healthcare system. After this wave crests, and it certainly will at some point in time, the daily numbers will come down, but they will stabilize at a new level, which is likely to be much higher than what we have been used to before. In other words, we are not going back to a scenario of low daily cases anymore. It's not going to be possible because we are moving forward to learn to live with the virus, and we are continuing with our reopening plans. So that's part of the adjustment that we all have to make to prepare ourselves for the time when COVID becomes an endemic disease and learn to live with more daily cases. But because of this rapid surge in cases and the stresses and strains we are seeing on our healthcare system and on our healthcare workers, we have to put in place these temporary breaks. I know this is not an easy time. It's hard for everyone to adjust to tighter measures again. I fully understand that. So I seek your understanding and support and your forbearance. Once our healthcare system is stabilized, once a new healthcare capacity is in place, we will continue with our reopening plans. Meanwhile, let's continue to support one another and look out for each other, especially our frontliners and our healthcare workers. We will get through this together. Thank you.